Yes, it does.
First of all, I want to thank you guys for being here. I really want to thank the governor for taking time out of his busy schedule to come here to talk about a subject that is so important for healthcare. I mean, what's more important than your health? So, I was thinking, we all want to save tax money as much as we want, as much as we can. We all want to stretch that dollar as far as we can stretch that dollar. For many years, I don't know when it was passed, but it was about
It went into effect 2014.
2014 is passed. We've been paying for Medicaid expansion, and we get nothing from it because Kansas, we won't pass it. And so, what a waste of taxpayers' dollars that we're paying for this and we're not getting anything back. So, the governor's been traveling throughout the state on something that is near and dear to our hearts, I think, out here, because we know what it'll do for our rural hospitals and such, rural Kansas in general. So, without further ado, Governor Kelly.
No, thank you. Thank you, Senator. Can you all hear me, or do I need to have this closer? Okay. Thank you very much. And, the senator is right. You all are probably here because of the health benefits that Medicaid expansion would bring to your community, to this region, to the state as a whole. But what the senator was talking about is just the economics of this all. Since we've been eligible for Medicaid expansion, can you hear me, Dave? Can you hear me?
No, but we can move up.
No.
Yeah.
You know what, why don't I just pull this a little closer? That work better? Can you hear me better now? Okay. Is that better for the radio? Okay. You're very welcome. We have, Kansas taxpayers have sent over $6.5 billion every year since 2014 to Washington, D.C., a cumulative $6.5 billion. That has gone to Illinois, to New York, to California, every place else, for them to be able to take care of their citizens, for them to be able to grow their economy, and for them to be able to support their hospitals, particularly rural hospitals. None of that money has come back here, and it's ours, and it should be coming back here. The idea that Medicaid expansion is actually an expense is a false narrative. First of all, the federal government will be picking up 90% of the costs of Medicaid expansion. The state of Kansas will pay 10%. Last year, I put Medicaid expansion in my budget for the 5th consecutive year. The legislature took it out. That act cost the state of Kansas $70 million because the federal government was providing an incentive for states that have not expanded Medicaid to go ahead and do it. And so when I put it in the budget, it actually lowered our cost to the state general fund by $70 million. The legislature took Medicaid expansion out of the budget and then had to insert $70 million of state taxpayer dollars to cover that action. So it is not the expense that it's been laid out to be. It is actually, other states have found that as they've invested in Medicaid expansion, they're actually seeing savings in other areas, particularly in law enforcement, because you have people have access to mental health services. So many of the people going into our law enforcement facilities, particularly our county jails, are really people with mental health issues that ought to be directed someplace else, but can't be because we don't have the services, because we don't have the reimbursement to pay the providers. So there are just all sorts of ways and that Medicaid expansion is being presented as too costly, as something that benefits able-bodied Kansans. That also is another false narrative. The fact of the matter is that there are 140,000 Kansans, and I think about close to 5,000 of them here in your Senate district, Senator Dahl, who are actually working but just don't have health insurance. They're working in jobs that don't provide health insurance. You know those. Your restaurants, they're waiting tables. They're in your child care centers taking care of kids so people can go to work. They're in your nursing homes providing care for the elderly. Or in some other kind of job where health insurance is just not employer provided. We estimate that there are about 150,000 Kansans who would be eligible for Medicaid expansion. 140,000 of them we know are working Kansans. The other 10,000 are not. We don't know exactly what they're doing, but we anticipate that a number of them are staying home to take care of a young child or an elderly parent, or that they have some mental health issues that make it very difficult, if not impossible, for them to participate in our workforce. So we're really not talking about a bunch of able-bodied people laying around the house spending Medicaid money. We're really talking about people who are out working and just don't have access to health insurance. So, I'm here today really to sort of blow out of the water some of those myths around Medicaid expansion, but even more so to listen to you telling me what kind of impact Medicaid expansion would have on your community, on your hospital, on your citizens, on your law enforcement agencies. So I'm just going to open it up and let whoever wants to start, just telling it like it is.
Governor, you're gonna have to call on somebody.
Shy people. Okay, if you could turn your name cards towards me so I know who everybody is.
I would volunteer to go first. Giovanni Bonet, Executive Director of Immunized Kansas Coalition. I also serve in 2 state boards. I am a commissioner for the Kansas Hispanic Latino American Affairs Commission.
Very good.
And
Thank
I
you.
also serve with the State Board of Nursing. Now, I know that we're talking a little bit about the community here. I'm going to talk a little bit about vaccines. And so we know that vaccines is, a preventative visit, and it is covered by insurance 100% of the time. Now, for those that have private insurance, again, they have access to going to the doctor, getting those vaccines. For those that have Medicaid, and even those kids that might not qualify for Medicaid, we have the Vaccines for Children program. But then for the adults, we have absolutely nothing. And so we do have some adults that need that, that access to health care, but because of economic reasons or because, they don't make enough to apply for the ACA marketplace, they're uninsured. And so here we are with a population that is unvaccinated, that needs that access, and they're unable to access vaccines.
Giovanni, do you have any idea how many people you're talking about?
Well, just recently, the Kansas Health Institute conducted a study that said that about 10% of Kansas are uninsured. Now, we know that that specific study was made on the people that actually replied to the study and the survey. I believe that Western Kansas has a higher rate of uninsured population. That might be because of the work that we have here. We are a migrant community. We have those essential workers. We have those people that work at the beef meat packing plants, at the dairies, at the feedlots. And so unfortunately, they're uninsured. And so they don't, one, have access to a medical provider. And second, they just don't know what to do. And so we are here trying to figure out how to keep our community healthy, thriving, because a healthy community is a thriving community, and yet we don't have the resources to do so.
Okay. Yeah, I'm thinking that many of those are probably in that 4,000 to 5,000 range that I have, those statistics that I have of the people who are in Senator Dahl's district who are working but not insured. Anybody else?
Governor, specifically to your question about how many people in Garden City, I don't know where else I would turn to for objective facts on this, other than the Kansas Health Institute. And the Kansas Health Institute's report in 2020, which is a bit dated, but I can't imagine that there's been too much of a shift in that, suggested that over 1,500 people in Finney County would be uninsured and eligible for Medicaid expansion. If you look at it per capita of population, and I've got a copy of the KHI's 2020 report, this map of the state of Kansas by deepness of blue shows percentage per capita of the population that would be uninsured eligible for Medicaid under an expansion.
So from that, it looks like Southwest Kansas is deep blue.
Pound for pound
Yeah.
would be most impacted in it. You know, what maybe originally started out as something that could have been an objective policy discussion became a partisan policy discussion pretty fast over the last decade. And you know, I guess if you kind of remove yourself from that and just go back to the map that the senator pointed out, you know, if we put over $800 million toward a $4 billion economic development expansion in Johnson County, or we put $100 million towards a maybe $500 million dairy processing plant in Ford County. If you just look at that sort of 1 in 5 ratio, or here in Garden City, if you look at the collective development east of what we call locally the bypass, both industrial and commercial expansion, the state plus city investment in those is around 125 million. That's done a little bit over 1.4 billion in economic development, kind of that 1 to 10 ratio. This is in that 1 to 10 ratio before you spend any of those dollars a second time or a third time. That's going into the healthcare system, which I think we identify as a regional healthcare system, and that we'd be fighting pretty hard for from an economic development project standpoint to try to keep or even grow. Yeah, so that just kind of some numbers I arrived at,
Well,
specifically 1,500 plus people.
Right, and I think the numbers you were talking about, particularly about the economic development, I think one of the things that we've found, you know, we have had incredible success with economic development in the last 5 years. You know, the most in Kansas history. I think we've brought in over $17.5 billion of new capital investment across the state, and that's equated to about 62,000 new jobs. All of those employers need a healthy workforce, and I think that's where, you know, Medicaid expansion comes in again, is that we know from the states that have expanded Medicaid that they have more people who are healthy and working and filling those slots that our employers now have because of the expansion. So it's a good tie-in. I think the other area I'd really like to talk about, because we know that since Medicaid expansion was a possibility, we have lost 7 hospitals. 7 hospitals in Kansas have closed. Most of them have been in southeast Kansas, but we know that there are probably over half of our rural hospitals are now in danger, in the danger zone. And so I'd really like to talk about the impact of Medicaid expansion on our hospitals here in southwest Kansas. And we've got some really good people to tell me about that.
Thank you. I'm Twyla Lee. I'm the CEO for the Commons here at St. Catherine Hospitals in southwest Kansas. We have 3 hospitals, and we are a regional system in southwest Kansas, Garden City, Dodge City, and Ulysses. We strongly believe that the Medicaid expansion is important to strengthening access to care for the folks that are in our communities. Regionally, we support 19 counties with higher level services. So again, the Medicaid expansion is important. To rural Kansas in general, as you mentioned, there are a lot of our hospitals that are exposed and at risk. And so as bases shift and other competing demands for resources. So the increase in the cost of bringing physicians in, the workforce shortages, all of those things are compounding the cost of care. So anything we can do to help support that is important. We continue as a system within Common Spirit to, our mission is to take care of our people in our communities. And so we continue to move that forward. In fiscal year 2023, we provided over $17 million in charity and uncompensated care. We're on a trajectory to do more than that this year. So again, as we continue to take care of folks, healthcare is important. It is the preventative care. The Medicaid expansion would help with primary care. And again, that access to care before that disease state or whatever the need is becomes significant. And so again, opening up access is really one of our priorities. We have some stories from, where, again, our patients struggle to get access quickly. And again, that goes back to our efforts in recruitment and bringing folks to Southwest Kansas so that we can provide the care, because care is better local. And we believe that that's our passion and that's our call.
Sister?
I'm Sister Janice Tommy, and I am a board member of the hospital. But I also am with the Dominican Sisters Ministry of Presence, which serves the poor. And I want to do a bridge for hers as well as for Matt Allen's. This is a story, one of the stories. This man was sick, and he had already hospital bills that he hadn't paid, and so he didn't go until it was too late. So he died in ER, leaving his wife and 2 children. And that would not have happened had he had some kind of access. I also work with people that struggle financially all kinds of different ways. And many of them are working, but they just don't make enough to get private insurance. And one example is a young mother that gets 50 cents an hour too much to get care for her child. But she doesn't have enough money to do anything else about it. And so what we need to do is figure out a way to work with that. But when you're talking about the economic thing, the other side of it is I get people saying, well, I'm leaving Kansas. I know I'm pregnant and we don't have the money to do it. I'm leaving Kansas because we have this health issue that's coming up, and I know I can get Medicare in Oklahoma or whatever other state. And so we're losing our workers. And rural Kansas needs workers all the time. We never have enough. And so we've got to do something to support the overall economy. The people that are against the expansion have to realize they're cutting their own throats.
Sister, you bring up another really important aspect of Medicaid expansion, and that is, not only are we not keeping our workforce healthy, we also are losing them. And we're losing, you're talking about some people who are just in the workforce generally and are leaving because they need to get healthcare service. The other thing we know is happening is that our healthcare providers are leaving the state. Kansas is now an island in the Midwest. We are the only state in dead central America that has not expanded Medicaid. We just recently saw Missouri, Oklahoma's done it, Nebraska's done it, Colorado did it a while ago. And so we are bleeding not only our citizens, but our healthcare providers across those borders where the citizens can get the healthcare that they need, but the providers can get the reimbursement that they need in order to be able to continue to provide the services. So it's a double whammy, and you're right. It is something that those who have been opposed to Medicaid expansion need to really take a good look of the ramifications of that. It is not just what they purport, not denying healthcare coverage to able-bodied, adults. It is really denying reimbursement to our hospitals, reimbursement to our healthcare providers, and absolutely necessary vital services to our citizens. So thank you.
Go back
Thank you
to
for
this
bringing that
map.
up.
We have less votes out in the area where we are, where that's all navy blue. And so the people that are doing a lot of the voting are living on the side of Kansas that don't have a reality of.
Or a sense of urgency. I
Right.
mean,
Right.
nobody in Kansas City is gonna lose a hospital. Nobody in
Right.
Wichita's gonna lose a hospital.
And they've got more votes from the hospital, the area of Kansas that's white or light blue.
Yeah, I would also say to your point, in talking with the legislators who refuse to acknowledge it or even give it the opportunity to get on the floor for a discussion, there's just a complete disconnect. Part of it is usual suspects. They're so accustomed to hearing about this from people they, quite frankly, don't put any respect in or any trust in. It pretty much, if you have administrator or director in your title, those folks don't seem to have much respect for those titles. I think until we get our law enforcement in front of them and our employers in front of them, and our medical providers, quite frankly, until those people stand and demand that these folks look at all of the ramifications. I mean, to Sister Janice's point, this is the workforce that, and you can't say you're for economic growth and you're for development across the state and not be for the people who actually make that happen, which is the worker. Right now in Finney County, we have 4,000 open positions. We have less than 30 people on unemployment benefits. We have less than 200 people saying they're looking for a different opportunity. So tell me where the able-bodied are who are living off of the government dole, because we certainly don't have them here. If we did, I'd be more than happy to go help them join our workforce. They're not here. Everybody here is working. And unfortunately, not everyone here has the opportunity to participate in a traditional healthcare system. They just don't. And it absolutely is showing up. Our law enforcement's dealing with it. Our fire department is dealing with it. Our EMS. Until we get the right voices, I think very, very concerted and very centric on what the need is, I don't think we're gonna see a change in those legislative voices.
Alana, you're spot on, and that is exactly why I'm here today, is so that we can get those voices to speak up loud and clear to the right people. And I know you don't have as many votes out here, but every vote counts. We actually passed Medicaid expansion back in 2017. Remember that, Senator?
I do well.
Yeah, and the
I didn't
former,
get a vote for it, though.
what?
I didn't get a vote for it in the Senate.
You didn't?
No, we voted, the House passed it, we did.
Yes, we did, because we sent the bill to the governor, and the governor vetoed it. It was the second time that you're talking about. So actually, in 2017, we did. Both the House and the Senate passed it, and it went to the previous governor. He vetoed it, and the legislature was not able to override his veto. So, we know that, there was bipartisan support, that the rank and file legislature understood the value of Medicaid expansion and voted for it. Unfortunately, ideology got in the way with the veto. As we fast forward, then again, there was an attempt to pass Medicaid expansion, and the senator's right, the House did pass it. I think it was in 2018. It could have been 2019. And it went over to the Senate, and leadership in the Senate blocked it from debate or vote. And so, no, we didn't get an opportunity to vote on that the second time. And then since then, the House leadership and the Senate leadership have just bonded together and blocked it from discussion, debate on either side of the State House. So we're here today because we know that, one, it's just absolutely imperative that Medicaid expansion happen here in the state of Kansas for our people, for our communities, for our economy, for everything. And so what we need to do is exactly what you were talking about. We need to get your voices and the voices of others in your community to become very loud and consistent and directed right at the folks who can make a difference. Now, we've got a representative sitting in the back there, Representative Younger, who I think is one of the ones I often talk about, the legislators who would love an opportunity to vote on Medicaid expansion. Senator Dahl has been another one of those. They're hampered by the leadership in their chambers. And what we need to do all across the state of Kansas, and you need to do here in Southwest Kansas, is give them the backing, the support that they need to, honestly, to go up against their leadership, to demand from their leadership that they have this opportunity to do what's right for you and for their constituents. So I would hope that, you know, Lana, you and everybody else around here takes that message out to the other folks in your community who are not here, and that you figure out a way to provide the support that your legislators need to be able to do what they have to do. And it's very hard to do. I was in the legislature for 14 years. I understand how hard it is for the rank and file to go up against leadership. It's tough. There are often repercussions. But as somebody sitting here knows well, but, you know, it's time that we support people who want to support us. So we could do that. And, you know, Lonnie, you brought up law enforcement. I think we've talked a little bit about that before. And Matt, my guess is that, and if there are others here, you know, do we have any commissioners here who want to
We do.
talk about? Yeah,
They should be screaming.
we
'cause
want to
it's all
talk
coming
about
down
that,
on this.
yeah.
Well, when you're talking about mental health and law enforcement, we're lucky that we have an agreement with our local provider on mental health in our jail and in our juvenile side too. It is a problem I can see in other rural, very rural counties, because I don't classify us as rural compared to our neighbors anymore.
They're frontier.
Yeah. So it's, we're fortunate there. You know, it's one of those programs that, you know, we have quite a few open positions, but our prospective employees that we talk to aren't interested, the younger people aren't interested in what your health care plan is. They want to know what the wages are. That's just what they tell the HR people. And so I have a hard time trying to figure out that we need to do more on health care when we already provide it and they don't utilize it.
Well, that's partly young people.
Well,
Yeah,
just young people.
Yeah.
Yeah.
I think, you know, there was an example, I think, Sister, you brought it up, of a pregnant woman who was probably a relatively young woman who actually left the state in order to get that health care coverage that she needed in order to be able to afford to have a baby. So I think they're there. You know, they just may not be talking about that at the time of employment.
We have another commissioner, Governor Roy.
Okay. Commissioner Cessna, do you have anything?
And I kind of piggyback off of what Lana and Matt were saying. You know, it's economic development for our community. You know, it's where we're kind of in an island of ourselves with trying to recruit physicians with the hospital. It's hard to recruit because we're out in the middle of somewhere, which is out in the middle of nowhere, which is out in the middle of everywhere, you know. So it's really hard to recruit physicians here. But then when you have the lack of resources like we do, without the Medicaid expansion, it's hard to recruit the physicians that we need to come here, because we do have a shortage of family care physicians in our community. And so people are looking outside of our community to try to fill that need. And it's just hard when you don't have that available in our community as a regional hospital to fill those needs in our community and the region. So that's another issue, and it's an economic development issue for our community and region, kind of like what Matt showed on the map.
Yeah, I mean, you're absolutely right. You already have difficulty, and you always have, and you always will, given your location in recruitment of professionals. Everybody knows that. And that's why I think it's imperative that we as a state do everything we can, give you every tool you need to mitigate that concern. And certainly Medicaid expansion in the area of healthcare providers would be a mitigating force.
I would
We
say,
have a guy who kind of has an unusual, he kind of started his own gig and it's really taken off really well. It's Joe Coles.
Thanks,
Just
John.
travels everywhere.
We're old basketball coaches. He used to beat up on me all the time, so I was feeling sorry for him.
Okay, now it's your turn. Go ahead.
Governor Kelly, I want to speak upon that. What we did is I'm an educator. If you look, and I'm very proud of this, these are the schools I've been in the state of Kansas in the last 20 years as an educational consultant. And recently a business consultant, and the reason a business consultant is kids I used to have in leadership, and that's one of the things we consult in, are now running businesses, and they're asking us to come in and train their businesses. So as we're seeing in most of the rural areas, particularly western Kansas, we're having declining enrollment in schools. Our towns our communities are getting smaller. And so 6 years ago, we started, how can we keep our graduates in Gray County? I live in Cimarron. And it's grown into, with zero budget, zero employees, to how do we keep our graduates in western Kansas. In May, we started a nonprofit. Finney County has been instrumental. Their commissioners have donated $50,000 to us. We've had all kinds of workforce developments, all these kinds of people. We service the area of what is called Southwest Plains Regional Service Center. They're a service center that services public education, and we work with schools in that area. It goes about as far east as Greensburg in that area, far north as Scott City, and then the rest. So what we've done is we've formed showcases, and we have showcases in healthcare area. We have it in agriculture, we have it in education, we have it in business tech. We've recently, because of Garden City's input, we're going to have a showcase here in Garden City on city, county essential services, what kind of careers they can come here. We also have a smaller area showcase for that. And the purpose is to build relationships. And it's not just a career fair. We have an ag showcase next week at High Plains Feed Yards, Tom Jones, and down by Montezuma. I just got an email this morning. We have over 165 kids coming from 14 different districts. We had a general one. We had over 19 different communities come. We build relationships. We got 12 businesses that are going to be part of that ag showcase. Not only do they introduce and talk about their businesses, but we put kids in small groups and they go around and ask about what kind of careers. MJE in Montezuma, Kansas employs 300-400 people. It's a dirt moving company, but they also need accountants. They need all of these. But all of these people, if we're going to keep them here, we all know if we can get a local to stay, they're going to stay. We can move people in and they're not really used to western Kansas. They may stay, particularly if they marry somebody from western Kansas. But if we can keep a local here, it's priceless. And so that's what we're working on. But we not only just a career fair, we work with them on essential skills. We work them on resumes and that. And we do that we have our own student-led leadership team. What I found in working with schools, and then I have businesses, what are skills young people are lacking when they come to go to work for you? One of the big ones is the lack of self-starters, self-initiative. We tell them what to do in school, we show them what to do in school, but we don't let them figure it out. So we're teaching a lot what we call student-led. And so we have our own student-led team that is part of this. And for instance, next Thursday, They will be taking care of those small groups. They will be leading them around. They will be talking to their group about first impressions. They will be talking to the group in the afternoon about resumes, those kinds of things, along with building relationships with businesses. I'll try to keep it brief. I'm a talker.
How did you two ever get a word in edgewise?
That's why we competed.
Yeah, well, again, Joe, you're talking about a really important group that, would answer some of your workforce shortage issues if you were able to keep your own, grow your own, keep them here. But again, this does tie back to Medicaid expansion, providing your community another tool to be an attractive place for young people to stay and to grow their own families. And so, there's hardly an issue we can talk about that doesn't somehow come back here to Medicaid expansion. So, I think one of the ones that we've touched on very, very briefly here, but I think is one that impacts so many aspects of a community. And again, where Medicaid expansion would make a huge difference is the whole world of mental health. So if and Matt, I'd really appreciate if maybe you could start that conversation about what it's like as a city manager to deal with all of the mental health issues that face your community, both from an individual, your citizens, but also then the agencies, your provider agencies across the way, whether we're talking, about law enforcement or your social service agencies or your school district.
I'd be glad to, and maybe on two fronts. I think more directly to your question, we've seen it since, a decade or more ago when the state's income tax strategy was, to drive that down. This was one of the big three legs of where the expenses were, and higher ed was going to be politically unpopular to take from there. K through 12 was not going to be a place that was going to come from. So kind of this other area encompassed state funding towards services like the one that works with Finney County and in our area, Compass Behavioral Health. The percentage of their budget to go meet the need of the community was dwindling. And the prognosis then was, we've got a perfect storm coming because there's existing services now being provided with predominantly by state funding, that is going to fall on the shoulders of local government, but then is also going to be eliminated. So you're going to have this absence of service to those requiring it now, and the inability to meet the needs of those coming into the mental health system later on whatever degree of the spectrum that was. So, I think 10 years ago there were people crying out in the wilderness saying, these chickens are going to come home to roost. In about a decade, you'll be in a mess, and we're in that mess. And so from, a law enforcement standpoint, we're doing everything we can we're the largest city in the western half of the state. We're still a small community, and we're trying to figure out how we do co-responder and really get things to where the right person is with the person needing help at that time, and it's not just a law enforcement officer. It's not just someone that's making a life or death situation in that moment. And that's kind of extreme examples, but our social service agencies, are tapped as well. I mean, that you've seen mental health in all its different variations really kind of drive their services in a direction. As an employer, it's become a huge part of what we look at from a benefit standpoint. No longer do we look at our health benefit as just a Blue Cross Blue Shield card or whoever your company has of choice. That we're kind of intervening in different ways. We went to kind of employer-provided nurse practitioner clinic. We've expanded that to allow for mental health counseling services and those types of things. We've are looking right now at expanding just our chaplaincy program, where you used to have a chaplain in your police department to saying, we need chaplains all over our organization, just as kind of that first line of interpersonal place to debrief or check in on mental health and mental wellness. So it's become a major focus of not just me as city manager of City of Garden City, but I think people in leadership roles of public and private organizations all around the state.
Okay, thank you.
Governor, I screwed up and didn't put a provider on this panel, but we have a provider here. Wouldn't it be interesting to hear from a provider?
Sure. Who are you talking about?
Dr. Myers.
Okay.
They're all interchangeable.
Okay, would you introduce yourself and then?
I'm Michael Scholl. I've had the privilege of providing pediatric care to our most valuable resource here for the past 35 years. And thank you for the introduction you gave to the governor. I missed part of it, my apologies, but and to what Twyla Lee said. After practicing here for 35 years, I can assure you the need is not going to go away. People are still going to come to our emergency room. They're still going to come to our clinic. We are still going to provide care because we have to. It's what we do. And we are the only people in town doing it. The only people in the region doing it. The costs will continue to grow. Can't make those go away. I'm saddened that we keep sending our tax dollars to Washington, and my money and your money is sitting in Washington. We're sending it to other people. Because of the fact the costs are going to continue to accrue, the hospital is going to have to cost shift, and the rest of us will absorb those costs, whether it's things written off, whether it's increased costs for services that we're paying for. Once again, my very naive response is, it's our money, it's my money, send it back and let us use it. Is there an incremental cost involved that we're getting pushback by taking money from the government? No, it's not government money, it's our money. The cost benefit is so easy. We will gain so much more by getting our own money back with Medicaid expansion. So please do everything you can. And thank you. Thank you.
I am doing everything I can. I need you to do everything you can to help me get this done. I mean,
the costs are still, the needs are still.
Yeah, they are, and you're right, they will just continue to be there. And you brought up the emergency room aspect, which is something we haven't specifically talked about, but, we talked about how, our jails are, getting lots of admissions that really shouldn't be there. They should be directed towards some sort of mental health facility. It's the same thing that we find in our emergency rooms, is that often you've got folks coming in there who are really in a mental health crisis, not in a physical health crisis. But you also have people who are in physical health crises coming in there who wouldn't have been, and you brought up some examples before, who wouldn't have been in a physical health crisis if they had had access to preventive care or to chronic disease care. And so, I mean, I don't know how many ways from Sunday we can make the case for Medicaid expansion where it'll finally sink in, but I think we've got to keep trying.
As a personal aside, we mentioned people who are part-timers or underinsured. I had to put my mother in assisted living a year ago. The facility she's in takes wonderful care of her. They have one part-time, 13 PRNs, and 7 full-time. The PRN, the part-time staff, is what makes this facility run. It's who takes care of my mother each and every day. They are working, they're underinsured. They're trying to work, they're making a living, and yet there they are in healthcare, and they can't get healthcare needs.
Yep.
People are, these are not freebies. People keep spinning this off as a handout, and that's not the case.
I understand. Thank you. We've got about 5 minutes.
Okay, one quick, on the mental health side, I'm a school guy, I'm a former school counselor. There's many mental health problems going on in our schools. Some of our schools and the education department has suggested you have a mental health person in your school and you have a counselor, quote, career counselor in your school. Some can afford that, some can't. And so those ones that are the smaller schools that can't afford it, they've got to extend for mental health purposes. I just talked to a small school recently. They had 6 possible suicide students in their school that mental health person's working with. So the mental health thing is going on, and when I was one, I would resource out, but that's almost impossible now to do some of that because of the lack of people, finances. So the mental health is huge in schools.
Yes, it's huge in the schools. We also know that it's huge in our veteran community. We know it's huge in the ag community with our farmers and our ranchers. It is everywhere. And, one more, and maybe the last reason we can talk about that we need to get Medicaid expansion. I do want to thank all of you. Thank you, Senator, for organizing this. It's really terrific. I think we've had, before I stop, Representative Younger, is there anything you want to say?
There's a lot I'd like to say, but, I just thank John for getting this organized, but I went to a Kansas Association of School Board meeting this morning in Dodge City, and everybody was invited, legislators speaking. There were only 2 of us that showed up. John sent an email to legislators for this. There's only 2 of us here. My passion, I spent 36 years in public education, that's my passion. Medicaid is quickly becoming that. We need people to show up and listen to what's going on, because it's so important to our state. So that's all I have.
Thank you, Representative Younger. We need people to show up and to listen, and then we need people to act. And I think, if I can leave you all with that, you showed up here, and that's fantastic, and your input has been invaluable. Now what we need to do is to take this to your broader community, and then have your broader community, the business people that you were talking about, the law enforcement people you were talking about, your citizens who are thinking about leaving our state. We need to take it to them and get them motivated to then turn and talk to their legislators, really insist that their legislators, only 2 of whom are here today, but to the other ones, to go there and tell them that they need them to push on the legislative leadership to bring this issue to debate and to a vote in the legislature this next time. Roy?
So just a quick question, Governor. You talked about leadership not even taking a look at it. Is it, and you talked a little bit about ideology or Republican, Democrat. So I'm just sitting here going, so what is it that leadership doesn't want to look at it for? Is it ideology, or is it something else that we can talk to our representatives to let them know why leadership isn't looking at it? From your perspective, Governor.
I think, it's hard to say. It's hard for me to put myself in their heads because this makes no sense, absolutely no sense, to not expand Medicaid. I can only think back to, 2010 or whenever they started talking about the ACA back in Washington, D.C. And at that time, it just ended up becoming incredibly partisan and ideological. And if you remember when the ACA was first passed, it actually mandated that the states expand Medicaid, right? And then that was challenged, it went to the courts, and the court said, no, you can't mandate it. So then all the states were on their own to decide whether to expand Medicaid. There were a lot of states who decided not to do it then, but then as time has gone on, now 40 states have expanded Medicaid, only 10 have not. So I think we're just trapped in an old ideological battle that other states have fought and gotten over and moved on and accepted the fact that the ACA is here forever. And, rather than shooting ourselves in our foot by not taking all the taxpayer money that we're sending back they're just stuck. And they need to be unstuck. And the only people who can do that, I believe, are the legislators who are there, who want to be able to expand Medicaid for their communities, but need to break the deadlock with leadership or go around them. There are ways that, the legislature takes a lot of votes, but they can go around leadership and bring something for a vote. So, it's asking a lot, but it's worth a lot. Medicaid expansion is worth a lot, and I think we've got a number of legislators who are willing to spend what it takes to get this done. But
Thank
they're
you.
going to need your backing, they're going to need your support, and that of all the citizens within your community. So, there's no doubt. Some have to worry about the ramifications of getting thrown off a committee or doing whatever, but others are concerned about have to be concerned about reelection, and bucking leadership means that you might get primaried, and it's tough to ask them to put that on the line, but we've got to ask them to put it on the line. Kansans need them.
Thank you.
Thank you.
Thank you. Thank you all really very, very much for being here today.
I'd like to thank Joy and you guys for that, and Tom, who's running for city commissioner, thank you for live streaming it and such, and
Oh, thank you. No idea.